In this study, we evaluated the influence of menopause symptoms on work outcomes and assessed subsequent economic impact. Hi, I'm Dr. Stephanie Fabian, professor and chair of the Department of Medicine at Mayo Clinic in Florida and the director of the Mayo Clinic Center for Women's Health. I'm here to tell you about an original study that will be published in Mayo Clinic Proceedings entitled Impact of Menopause Symptoms on Women in the Workplace. We invited women between the ages of 45 and 60 years who were receiving primary care at one of the 4 Mayo Clinic sites in Rochester, Minnesota, Scottsdale, Arizona, Jacksonville, Florida, and the Mayo Clinic Health System in Northwest Wisconsin to participate in the Hormones and Experiences of Aging, or HERA, survey study. Over 32,000 surveys were sent between March and June 2021, and about 5,200 responses were received. 4,400 participants reported current employment and were included in the study. Our primary outcome of interest was self-reported adverse work outcomes related specifically to menopause symptoms. Participants were asked if they had missed days from work in the last 12 months, cut back hours at work in the last 6 months, had been laid off or fired from work in the last 6 months, and whether they had quit, retired, or changed jobs in the last 6 months, specifically because of menopause symptoms. Women were of mean age, 54 years, and participants on average reported a moderate menopause symptom burden based on the menopause rating scale. Overall, 13% of the women reported at least one adverse work outcome due to menopause symptoms, and 11% reported missing work in the preceding year, with a median of 3 days missed because of menopause symptoms. Interestingly, there was a strong association between menopause symptom severity and adverse work outcomes. Women with a higher MRS score were more likely to report an adverse work outcome as compared to those with lower scores. Specifically, women with the most severe menopausal symptoms were nearly 16 times more likely to have an adverse work outcome when compared to women with the least severe menopausal symptoms. The association between menopause symptoms and an adverse work outcome was the strongest in the psychological symptom domain of the MRS questionnaire, with women in the highest quartile being 21 times more likely to experience an adverse work outcome versus those in the first quartile. Additionally, although the numbers of racially and ethnically diverse women in the study were small, a sub-analysis found that Black women were nearly 3 times as likely and Hispanic women 1.6 times as likely to report an adverse work outcome compared to white women. This is the largest study to date examining the impact of menopause symptoms on work outcomes. And based on our findings, lost work productivity related to menopause symptoms results in an annual loss of $1.8 billion in the United States. This estimate only includes paid employment and does not include the unpaid work women commonly perform, such as caregiving. The findings of this study highlight a critical need to improve the medical treatment of women with menopause symptoms and an opportunity to make the workplace environment more supportive for women going through this universal life stage. This is extremely important for our patients as well. Women in midlife are at a time in their lives when they're experiencing career success and achieving leadership roles. That women may opt out of employment and consequently out of the leadership development pipeline identifies a potentially unrecognized reason for the leaky leadership pipeline and another factor contributing to the paucity of women in senior leadership positions. Further, the impact of women's early exit from employment includes the potential risk of financial insecurity later in life, in addition to lost potential for career advancement and an important loss of human capital from a broader perspective. The takeaway message of this article is that midlife women, who constitute a significant proportion of the global workforce, experience a range of menopause symptoms that can influence their quality of life and their careers. It is more important than ever that we increase the knowledge and awareness of women, clinicians, and employers on the global experience of menopause. This will facilitate the discussion about menopause symptoms in the workplace and will prompt efforts to create and implement workplace policies to support women during this stage of their lives. Additional studies are needed to confirm these findings in larger and more diverse groups of women. I invite you to read the article for additional details on our study.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.